Our final presentation now, as we talked about the measure of hope and the city of hope and why that is important, we're looking at the mind-body connection, developing coping skills to enhance self-care and quality of life. Let's welcome Elaine Smith.
Good afternoon. So good to be here. It's a little tough being the last one. My anxiety is off the wall. And now I'm talking about mental health. But I want to thank Jan, too, and all of you. I mean, the inspiration in the room here today and the presentations and learning all that we've had to help us cope and deal with some form of chronic disease has been amazing. So thank you very much. Thank you, Dr. Kelman, who is my colleague back in Atlanta, for saying that we moved from fear to enhancing strategies that help. I am a maniac around the hospital. I am the mental health guru. Whether it's sleep, whether it's fatigue, whether it's finding initial sort of interventions immediately to help patients cope. We have a big department. We have social workers, psychiatry, licensed clinical therapists. So we do conventional psychotherapy, but we also do a lot of psychoeducation. That really my focus is in group work, support, learning how to manage stress, learning how to manage anxiety, learning how to calm the wandering mind, which wakes us up at 2 o'clock in the morning. So what I've learned, I've been at the hospital for 12 years. I came from a very conventional practice in Indianapolis that I had for like 25 years. And it took me a while to learn. It took me a while to learn really how to relate to cancer patients. Came down to set up the behavioral health department. And honestly, in that environment, at the first, I didn't really know what I was doing. How do I talk? How do I bring it up? What's the elephant in the room? And one of the things I've learned, and mostly in doing like research, learning things, but really learning from my patients, is there is no bigger 6-letter word than cancer. It's a showstopper. It is, I can't imagine. And a lot of patients hear this on the phone. They get a phone call. Yeah, your test came back, and they hear it on the phone and your life changes in 1 second. And there are so many things that come in terms of your own coping mental health. Like, am I gonna live, am I gonna die? Families, caregiver support. How am I going to support the family? Am I going on disability? Am I going to be able to work? What is the treatment going to look like? And then we circle back to, am I going to live or am I going to die? So it is a lot initially of a lot of negative emotions, a lot of fear base, a lot of the unknown. I find that patients have more difficulties with anxiety and grief. Nobody hardly ever talks about grief when we're talking about mental health. But if you think about that diagnosis, the initial shock and stage, along with, am I going to live or die? What's going to happen? Will I be able to do this? Will I be able to afford this? There's all of this loss of potential freedom, loss of independence, loss of just the fears. Those are all fears. They're not necessarily true, but that's the role anxiety plays. So in its wisdom, the Commission on Cancer set up in 2012 a thing called the distress screen. I don't know if you do it down here, but it's done in our clinic every visit. So it's an immediate screen that's ranked between 1 and 10 on the level of stress. And it focuses on pain, psychological well-being, spirituality, practical problems, and what was my last one? Pain and finances. So we make sure in the hospital, on initial visit and any other visits, if you score above a 3 on the distress screen, we utilize as many resources in the hospital or out of the hospital in order to help you cope with that. Because a lot of patients aren't from Atlanta. A lot of our patients, we're a destination hospital. So we have to have a lot of knowledge. Our social workers work really hard looking at how to sort of alleviate any of those distressors that come up. So when we start with a patient, once we sort of get into meeting the doctors, the treatment plans make a huge difference in your mental health and coping. Because once you know, this is what I'm going to do, this is how I'm going to do it, this is how long it's going to take, and this is the hope that we're preparing for, huge word, positive psychology, is we move towards different stages in terms of empowerment of patients. So Dr. Kelman mentioned a book that's almost like a Bible for me, and it's called Radical Remission by Kelly Turner. And in that book, it's scientific based, it's the 9 traits that people have who heal. The first 2 are physical. Nutrition is medicine. Take your supplements. We have this in our room. Spirituality, psychology. Those are the top 4, and they're sitting all in this room, okay? And they probably, like when we're going over with patients, I find that a lot of patients have most of these 9 traits. The other ones are more to do with your emotional well-being, which speaks to how important your mental health is. Be an advocate for yourself. Speak up. Use your intuition. You know your body. Put out to the universe a strong will to live. Next year, when I'm at my granddaughter's birthday, we're going to go on a cruise in 2 years. So a strong will to live, planning your life, advocating for your life, using your intuition. Release suppressed thoughts. One of the things that I found out in sort of mental health and in well-being with patients is they have a lot to say that really, unfortunately, and I don't mean it this way, but a lot of times no one wants to hear it because it's scary. A lot of times a patient just wants to say, am I going to be okay? Am I going to make it through this? I don't know, I'm getting too tired. And those are the side effects of treatment, but it's really important. It took me years to just learn, listen. Really, it's just a matter of getting those out. Nobody really wants to give up. Nobody wants to leave. Nobody doesn't want to do well. But just to say, it's tough. It's tough. It's hard on you. Yeah, it's hard on me. Changes their whole ability. It actually re-energizes you as a patient. And it's a tough thing for caregivers to learn. And we work a lot with caregivers because if you have a family member that has cancer, you're a patient too. Your stress levels are up. Your fears are up. Crying by yourself sometimes without other people knowing, not wanting the patient to know. I mean, just sometimes I am so enamored by our caregivers at the hospital. Their love. I mean, 2 things I've learned from patients. Love and spirituality. Key issues. They're key healing issues. Things that make you feel supported, make you feel empowered, make you feel in charge. And when I'm around the hospital and I see patients that are suffering some fatigue from treatment and the caregivers are right there and lifting them and pushing them and taking care of them and being the cheerleader, it's just incredible to see that amount of love that goes on and the hope that brings. So helping patients be empowered during their treatment, have a sense of well-being. One of the things I really have to do is reduce anxiety. Anxiety, that's a bugger. It just sits there. Anybody ever wake up in the middle of the night and start worrying? Yeah, it's like constant. It's like your brain, the brain is like your major computer, right? So you go to sleep at night and you get in bed, and a lot of times I work with sleep-related issues, especially with the radiation groups and things, teach people how to sleep, because sleep's restorative. And all of this is mental health stuff. Although they may go to Dr. Kelman or could go to Dr. Nimrod, that mental health of learning how to manage anxiety, cognitive behavioral therapy. How you think is how you feel is how you act. So if my thought is, I don't know if I can do this, I'm going to feel scared and frustrated, and I'm probably maybe going to get irritable and withdraw. So being able to have a sense of managing that thought process, because I have to interrupt it somewhere. They're like little arrows all going together. The feeling can bring the thought, that can bring the behavior. So teaching patients how to minimize the anxiety is something that we do with meditation. So meditation sounds a little scary, like you feel like you have to be the Dalai Lama or something. But you have to have strategies. And teaching patients, one of our rules is we live one day at a time. When you come in our office, that's one of the things you're going to learn. We can't live 2 weeks from now. How many of us do that? That's the role of anxiety. Anxiety can actually give us panic attacks. Anybody ever had a panic attack? A panic attack is adrenaline and cortisol gone wild, right? So it's just like physiologically we can't even slow ourselves down. And a lot of times with anxiety that is sort of rampant, what we end up thinking is that it's going on right at that moment. But a panic attack with cortisol and adrenaline is a buildup. It may have been something that happened 2 weeks ago, but I didn't really pay that much attention to it. So all of a sudden something happens, it's all sort of suppressed, I don't realize it, and that anxiety can take over, and I feel like I'm having a heart attack, or I just have this gut punch. So teaching patients to manage anxiety, we use meditation. We do a lot of breathing around the hospital. It's free. Anybody done it? Has anybody ever done any breathing exercises? Oh, good. We're going to do one here today. I've got some exercises we're going to do. So, what breathing does is that we teach anxiety. It isn't the thought. Like if I think, I wonder if this is going to work. I can look at that thought without judgment, but the second thought's going to be my problem. I wonder if this is going to work. Second thought. What if this doesn't work? Then what am I going to do? How am I going to do this? Where am I going to go? How am I going to afford it? So we teach our patients how to interrupt at the first thought. We teach them how to live one day at a time, and we teach them how to sleep at night. So when we're living one day at a time, one of our techniques is, I tell patients, before you get out of bed in the morning, do not get out of bed for 10 minutes. And we do 3 minutes of therapeutic breathing. We do 2 minutes of prayer. We do 3 minutes of gratitude. And we take a minute to send off a meta-communication, a loving meta-communication to somebody that we love or care about or might be having trouble, or a patient we met at the hospital. Then I tell them, take God's hand and say, where are we going today? Put your feet on the floor, but enter the day and say, this is Saturday, only Saturday. I really, and this, I've learned all this from patients. I really could care less about Sunday. I don't care. It's going to come. I'm going to do my 10 minutes. Whatever is going to be delivered to me that day. I am going to jump, go around, fix, alter, or change in some way, but I will be able to manage it. If I think about tomorrow, today, usually those things are about that high, and I can't get over them. So living one day at a time and living mindfully, being able to be really present, being able to, has anybody ever practiced any mindfulness? You know what that is? Mindfulness is a sense of just being present. The best way that I can describe it in terms of our anxiety reduction and our mental health with patients is to be able to be in that moment. So if you're, and practicing it, it becomes a skill. It's actually a skill. And you have to work on it a little bit, but a lot of times we're sort of a force of nature that has a tendency when it comes to ourselves to give up too fast. So when you think about things like, I'm going to learn to meditate. Well, it didn't work that well. Okay, I'll try it another time. But instead of developing it as a skill and sticking to it, it's like self-care. I know I have Paulette in front of me here, who is a major walker. Everybody must know that in this room. Goes 6 to 9 miles a day, but she practices self-care. So in the middle of all this angst, all of this coming and going from treatment, all of these scans, fear of recurrence, all of the things that we have, how do we manage our mind? What we do is we learn to soothe it. We live one day at a time. We develop focus. We use mindfulness, and we're present. A lot of times, like just to practice, we'll just eat lunch and just only think, chew things and taste them, get our brain to settle down a little bit. Your brain needs a break more often than we give it. If you think about your brain as a snow globe, all right? It's sitting there, it's 2 o'clock in the morning, your little brain is the snow globe, you open your eyes and flip that snow globe. Wow, you got 70,000 thoughts coming at you really fast, right? So being able to recognize that within a 24-hour day, by being present, by recognizing, I don't have to think every thought that comes in my head. I can recognize it mindfully, but I don't really have to think it. I can recognize that, am I going to have money to pay that bill? Everything in our life, interestingly enough, is not just about cancer, right? It's about paying bills, individual education plans for kids in school, about loss of jobs or having jobs or all sorts of things that we worry about. Have you ever noticed we never worry about anything good? Right? Whoever worries about wow, this is going to be the best vacation, I can't believe it. We always worry about things that scare us. And cancer scares us. Because I tell patients, the only difference between you and me at this moment is that somebody has, you think, somebody has told you how you're going to die. I'm sitting across the way, I'm going to die too, but nobody's given me that message, right? So I'm blithely going along, not having the intensity or the recognition. I mean, sometimes when we do journaling at the hospital, and I think I heard somebody say this today, the dancer. Oh my gosh, she was so beautiful. But right before she danced, she said, there have been some good things that have come from cancer. And that's one of the journaling exercises we do. We'll do a 3-minute focus. I'll be list all the good things that have come from cancer. Well, some of those are slowing down. Some of those are reinventing my life. Some of those are learning to really listen. Some of those are being more hopeful and being more happy. So being able to consolidate my life into a day, being able to enter my day, be mindful during my day, be able to review. The 10 minutes I start in the morning, we do 10 minutes at night. So we review the day. Say our prayers, review the day, look at things, and then say, my name's Elaine. I'll say, Elaine, go to sleep. I force my brain to shut down. I say, Elaine, go to sleep. Elaine, go to sleep. I do that 3 times. You have to try this because it does work. It really works. So you tell yourself to go to sleep, then you begin to do some therapeutic breathing. So you breathe in relaxation and you breathe out tension. This is meditation. You're going to breathe in relaxation, you're going to breathe out tension, and when a thought enters your head, you're just going to recognize it without judgment, that's mindfulness, and send it away, back to your breath. Your breath becomes your anchor. Like that beautiful saxophone player today, I was like feeling really anxious because I was looking at the room. And so I used the breath while he was doing the saxophone to sort of center myself. So your breath is free. You don't have to pay at a gym. It does amazing things for you. It can put you to sleep at night. If you wake up at 2 o'clock in the morning, you repeat the process. Elaine, go back to sleep. I do not allow myself to think when I wake up in the middle of the night because your brain thinks it's now 8 a.m. It's not. It's 2 a.m. Right? But there's these things we worry about during the day, but we're so busy doing so many other things, we don't really think that that's sitting back here in the back of your brain, okay? So when you wake up in the middle of the night, tell yourself, use your name. Don't flip the snow globe. Don't turn on a light. Don't look at your phone. If you have to go to the restroom, go, come right back. Tell yourself to go to sleep. Do your therapeutic breathing. Breathe in relaxation. Breathe out tension. Thought enters your head. Send it away. Back to your breath. And in the morning, you're going to wake up and say, it worked. So it is really important because sleep's restorative. We need to really get the recent literature says about 7 hours, but the reason it says that is that there's a pattern to sleep. 4 hours of really deep sleep, and then 3 to 4 hours of coming out of sleep. So waking up and not staying up between 2 and 4. If you're going to be up between 2 and 4, you might as well get up and make some banana bread. Do something constructive and then just get back in bed. But if you want to really go back to sleep, which is good for you, practice this mindfulness meditative process, okay? So although I know within my department and as a clinical therapist, there is a depression. I assess for that, we evaluate. Besides teaching, and very often refer to Dr. Kelman's team because there's so many things going on for patients in terms of, maybe irritability, crying, showing some real clinical signs of depression. I like for our patients, and they feel better about it, we kind of move to our naturopaths before we move to psychiatry. Looking at supplements, having an assessment by them, because a lot of times patients don't really want to take another medication, but they need to feel better. So being able to work really closely with the naturopathic team and with the nutrition team, nutrition is medicine, and our pastors, we have a whole catch of, that's mental health. It's just not us being able to do better, feel better, and sometimes it can be erratic. Sometimes you feel that kind of, I was fine yesterday, but I'm really off today. I was fine yesterday, I was really off today. So it's important to talk about those things and be able to get an assessment and get some supports. But being able to change your habits, being able to change your thought habits, being able to use positive psychology, hope and optimism. I was doing a lot of reading before in the last couple of days. And interestingly enough, as I was reading today, I pulled up this course from Yale on well-being. And I thought, I'm going to take that. You know, there's always something new I can learn. So they're going to focus on gratitude, happiness, and savoring. That's a sort of and meditation. But savoring is kind of an interesting new approach that you sit and maybe take 3 minutes and think about something that you love or care about, or something beautiful. It's like nature bathing. The Japanese do a thing called nature bathing. Like if you're going to take a walk, I was talking to Paulette about it last night. The first 5 minutes, you just drain your brain, you smell, you look, you feel, you see different things. You look at the cracks in the sidewalk, be able to keep your brain sort of, calmed. So I think if I had a goal when I'm looking and working with cancer patients in our department, is that if there's a barrier, we want to remove it. And if that barrier is anxiety or thoughts or feelings or fears, then it's our responsibility to jump in order to keep our patients and caregivers and families, and in line with being cohesive about their mind-body connection. Because it's connected, right? It's just right here. It's going to go down the stem cell. And that's what happens with stress, right? If you get really stressed, blood pressure goes up, heart rate changes, you can get gut response. We have more serotonin in our gut probably than our brain, right? You get GI issues. So that's all connected, staying calm and hopeful in the middle of chaos. And that's using techniques such as breathing, mindfulness, the sleep technique I told you about, doing journaling. We have a music therapist at the hospital, and he just came to a meeting the other day and did a 5-minute meditation for us. But these are practices that are essential to incorporate, because not everybody can find a therapist, not everybody needs a therapist. Sometimes we need lifestyle changes. We need to know how to control our thoughts, be able to look at a thought and be able to send it away and calm our body. A lot of times with patients, my assignment is they do 3 5-minute breathing exercises every day. And the 10 minutes in the morning doesn't count. So just they pull up on their phone or their computer, or they just sit there once they learn how to do it. But 3 5-minute breathing exercises. Reduce cortisol, reduce adrenaline, be able to calm yourself. You feel amazingly better after you do exercises like that. So we try to stay focused in the really here and now. We do a lot of group work, and we do a lot of work virtually. We do some body image work, we do meditation, we do a fatigue group. I had mentioned to Jan that really virtually, we could jump in and start doing some groups down here for any patients that might want to put together a women's group or anything, any way we can help. So, we got to do now, and that's one of the things that COVID did help us with, was to realize that we could be better connected, right? But, so being able to use these strategies make a difference in everyday care in life and protect your mental health. And when you're protecting your mental health, you're protecting your body. And if we can reduce cortisol and adrenaline, we can reduce the stress factor. And if we can lower anxiety, we can also reduce cortisol and adrenaline. So I thought we'd try a few of these exercises, okay? I think that I do some things called 1-minute focuses. A 1-minute focus is an exercise where you just drain your mind for 1 minute. Sometimes some of the men keep a rock in their pocket, And when they have their anxieties going up, they just pull out the rock and spend the time like feeling it. Like if it's curved, if it's soft, if it's smooth, if it has cracks in it, just anything to distract and change that rush of adrenaline and cortisol and bring us back to center. Sometimes I walk up to a picture in the hospital with a patient, and we just for 1 minute discuss the picture. We do a thing called 3-minute focuses in journaling, where we just ask a question because, as Kelly Turner said, get rid of suppressed thoughts. We ask the question and you just write for 3 minutes. And it doesn't have capitals, periods, anything. It's just letting everything out. And then we're going to do a 5-minute breathing. Okay? You want to try it all? Okay. Let's see if I know how to do this. David? Do you have any questions so far? Okay. We have to go all the way up. Okay. Okay. So what I do with patients is we'll go up to a painting. Do we have a second painting? Oh, you want me to do this? Oh, thanks, David. Okay. All right. Can everyone see the painting? Yeah. Okay. So this is called a 1-minute focus. You're going to drain your brain. You're just going to let it relax. Let it go to the gym for 1 minute, okay? Just relax. So we'll walk up to the painting, and all we do is discuss it. You can do this individually by yourself. So I might be, wow, I wonder where that is. I wonder if it's like kind of Himalayan. I don't know where. Look at the beautiful purple along with the rose-colored tree. What kind of tree is that? And that stream looks so peaceful. That's such a beautiful place. I wish I could maybe go there. And that grass kind of looks like moss. It doesn't really look like grass. It looks something softer. That looks like a place. Oh, and there's a bridge. I wonder where the bridge goes. I wonder if maybe this is Japan. I don't know, the flowers, the colors, the bridge kind of looks like that. The water looks so refreshing. It looks so comfortable. So we do that for like a minute or a minute and a half. Just let our brain escape. You can do it just whenever you feel it. You feel like you're tensing up. Give yourself like a 1-minute focus. You can do it, this sounds silly, but you can actually do it with a mint. You can put a mint in your mouth and you can start, okay, that tastes really good. That's really strong. That feels really, there's a little crack in it. You're distracting your brain away from thinking. You're giving it a break, okay? But it's just a 1-minute focus, all right? You'll have to, I thought I put an extra painting in there. I don't see it. This is an exercise, it's called the grounding technique. These are all exercises when your anxiety's up. Like the picture that I just did, sometimes I do that with a patient before we go into an oncology appointment. Just settle down, or we do a little breathing. But this is a thing called the grounding technique. You're in a spot, and you pick 5 things you can see. Green chair, lights up there. I see the curtain. There's my colleague, Daniel. There's a plant over there. Yep. The balloons. Those are cool. And then you think of 4 things you can feel. You can feel the chair. You can feel your clothes. You can feel the carpet beneath your feet. You could feel a piece of jewelry on you. Then you do 3 things that you can hear. Definitely hear the air conditioning, sort of a little bit of murmurs. Pardon? Yeah, oh, fan, yep. So you just 3 things you can hear. Then you do 2 things you can smell. Maybe you put a little perfume on this morning, or might be something around you that you can smell, but you're just distracting yourself. Then you do 1 thing you can taste. So it might be something you have with you, might not. It might be a taste that you just have in your mouth at that moment, okay? So those are all grounding techniques. Anxiety reduction, pushing away the wandering mind. Remember, anxiety, a new term for anxiety is the wandering mind. If you're living past today, you got the wandering mind going. And anxiety is a barrier to sleep, to comfort, to management, to focus, okay? And anxiety comes along with that cancer diagnosis, but we can learn to manage it, all right? So, let me see. What else did I have you to do? Oh, okay. So everybody in your thing has a little journal in your bag. Okay. So I'm going to ask you a question, so I need you to get the journal out, and we're going to do a 3-minute focus. We'll do a 2-minute focus. It's been a long day. So I'm going to ask you a question. And then once I ask you a question, all you're going to do is write. Okay? Okay, here's the question. What is something that happened or I learned today that's helping me feel better? Go. What's something I learned or happened today that's helping me feel better? Just write it out. Okay, and stop. Just 2 minutes. That is a way that you can get out suppressed thoughts. It's important to do that. Like there may be twice a week, you should just ask yourself a question and just write for 2 to 3 minutes. Any thoughts, any concerns that come along, because it's yours. You're not measuring it, you're not grading it, you're not reading it to anybody. You are just taking what is in your gut, putting it on paper, and getting it out of your chest. The area that can cause you any kinds of angst or frustration, okay? Did anybody, how did it go? Were you able to get stuff out? Could you just write? Okay, good. Think we're going to do a meditation. So it's going to be a 5-minute breathing meditation. Now, during the meditation, there may be a couple of minutes or a minute where you're on your own, okay? It's very interesting when you start doing breathing techniques that you'll notice my mind wanders a lot. But that's okay. Nurses at the hospital tell me all the time, I can't do this. Well, they're actually doing it by knowing that they can't do it, because they're recognizing it's a paradox. They're recognizing how often their mind wanders, how full it is, how busy it is. You know, that's a habit, guys. We're just trying to get rid of those difficult habits that can cause us a problem. It's like an addiction. If I'm doing an addiction intervention, I basically tell somebody, the next time you do that behavior that causes you a problem, do something different instead. So if the bar's to the right, you better go left. Okay? So if I'm going to sit and ruminate, maybe I better go do something different. So when you do a behavior that causes you a problem, do something different instead. Because you cannot control the world, but you can control how you respond to it. And that empowers you. It empowers you to have I mean, a lot of times we think there's maybe 6 different feelings: happiness, anger, joy. You know, it's like Inside Out. Anybody seen Inside Out? Yeah, so it's really important and really looks at children, but it's us too, you know? So ruminating, worrying is a habit which we can stop. Like, for instance, there's this exercise called passenger on the bus. So everybody pretend you're the bus driver. So you're on the bus, you're driving the bus, you got your hat on. Maybe it's a school bus, maybe it's just a big bus, but you're in the driver's seat. Now you're driving along and you're going to pull up to a stop, and you open the door, and in come your passengers. Well, guess what? Your passengers are your feelings. So in come your passengers, and maybe on that day, anxiety is making a lot of noise. Like just getting in your head, causing everybody problems, everybody's frustrated, you can feel. And so you have to recognize that and basically say, anxiety, get to the back of the bus. You're driving me crazy today. I can't drive safely. I can't think. I can't focus if you're going to be interrupting me all the time. Maybe sometime you open the bus and it's just joy. And you just enjoy that peace and that recognition that this just feels like a really good day. But it's a fun little exercise to do. Passenger on the bus. Open the door, in come your feelings. If one of them's giving you a problem, confront it. What does it mean? Why are you doing it? Why am I having a habit of paying too much attention to you? How can I discipline you? How can I quiet you down? Okay, so it's a fun little exercise to do. But we're going to do a breathing exercise. So you got to get comfortable. They'll give you some instructions. If a thought comes in your head, take the thought and send it away. Just recognize it, send it away, go back to your breath. Your breath is your anchor. Okay? All right, let's relax for 5 minutes. Everybody get comfortable. That position, maybe your back is straight, your feet are flat on the floor, your hands are comfortable. Let your shoulders relax. You can feel your stomach. You can feel your breath go in and out. Take a second and just take a deep breath in. Hold it. And breathe out. You may experience your breath in your lungs. You may experience your breath as it comes. Did they do it? I think they're going to be able to do it.
And allowing yourself even just a few
Everybody
short
get
minutes
comfortable. Here
of
we go.
intentional reflection can really have a positive impact on the rest of your day. So let's use these next few minutes to come back to center and set an intention for the rest of your day. Move into a comfortable position, whether you're seated at your desk at work or laying on the couch at home, and gently close your eyes and shift all of your attention onto your breathing, taking slower, deeper breaths than you've taken all day so far. Taking a deep breath in through your nose and slowly letting it out through your mouth. And continuing to breathe that way, feeling your lungs expand out as you inhale and contract back in as you exhale. Tune into your body, noticing how it feels. Noticing if there's anything that it's trying to tell you. Notice any place of tension or tightness in your body. And give those areas permission to relax. Sending love into those areas. Thank your body for taking such good care of you. And let it know that it's okay to rest. and relax for these next few minutes. You may notice that your mind starts to wander off. That's okay. That's natural. Just notice it and bring your attention back to your body, using your breath as your anchor. Try to picture one thing that's happened today that's made you smile, or made you thankful or appreciative. And just let that feeling fill you up for a moment. Breathe that feeling in from the top of your head to the tips of your toes. And allow yourself to smile if that feels natural. And now focus on something that you can do today, whether it's for yourself or for someone else, that will allow you to continue feeling this way. It could be something as small as deciding to go to bed early tonight, so that you have time to finally read that book that's been on your bedside table. Or the joy of getting dinner with a close friend. What's one little thing you can plan for your day to bring that intentional joy to it? Now just focus on that for a few minutes. Sit in that feeling of joy and peace. Now let's take a few more deep breaths together. A deep breath in, feeling your lungs expand out as you inhale, and everything contract back in as you exhale. Again, an even deeper breath than the one before it, holding that breath for a beat, and exhaling everything out. Last time, your deepest breath yet, sending that breath through your entire body. And exhale it out. And in your own time, slowly bring your awareness back to where you are. And thank yourself for taking these few minutes to just be intentional and kind to yourself. And when you're ready, you can gently open your eyes and enjoy the rest of your day.
Good ending, right? Does it feel good? Oh my gosh, your body's loving it, your brain's loving it. Just sort of wrap it up though. We can have calm in chaos. And using positive psychology, hope, like Dr. Kelman said, affirmations. I'm courageous, I'm strong, I'm joyful, I'm good, I'm powerful. Being able to start the day, use one day at a time. Squelch the habit of being anxious. You've got this. God's got this. You're empowered. God bless all of you.